Hi everyone, my name is Dr. Craig Banks. I am the founder of Pinnacle Chiropractic in Cuyahoga Falls, Ohio. I wanted to touch base on a recent situation where a gentleman, 28 years old, who had a history of neck pain and headaches for about 2 weeks, had apparently turned his head to one side, heard a pop, and then ended up suffering a stroke. Anytime something like this happens, people want to correlate chiropractic care and cracking your neck with stroke. I wanted to dispel the myth that is out there regarding that. No systemic evidence has ever shown that chiropractic care is associated with stroke. What ends up happening is that people are already in the midst of what is called a vertebral artery dissection. One of the predominant symptoms of this is headache. Frequently, when people do seek chiropractic care, headache is one of those symptoms that they'll seek chiropractic care for. If the chiropractor does not do a proper job of evaluation of the patient prior to working on them, unfortunately, if they end up proceeding and ending up having this vertebral artery dissection and eventually a stroke, the chiropractor will get blamed. The most recent evidence actually says that you don't even have to touch the person, and if they went to their primary care doctor who doesn't put their hands on the patient, they could just as easily have a stroke, whether or not they were at their primary care doctor or their chiropractor's office. I just wanted to address this regarding the safety of chiropractic. The estimation now is at 1 in, I believe, 15 million that a chiropractic adjustment is going to directly result in a vertebral artery dissection. That's pretty low odds. And if you compare that with side effects on drugs, surgery, or anything else, I think you'll understand that we're pretty low risk as chiropractors. Now, that is not to dismiss or trivialize the issue. What I would suggest is that all chiropractors that are out there and patients that are out there, keep in mind that a headache may not just be a headache. You do need to do a decent job of evaluation and management of the care that you're going to provide either for yourself, whether you're just sitting there thinking it's a good idea to self-manipulate. I personally never advise my patients to do anything like that. I don't ever want them adding force to their neck to get a pop and get that 20 minutes of relief that the pop will give them. Get to a qualified professional. As a chiropractor myself, I've seen numerous people in situations where they have come in to see me, and I was skeptical about providing a cervical adjustment because I was not convinced that they weren't in the midst of a vertebral artery dissection. I sent them off. One of the patients actually refused at one point and ended up having a stroke. I did not touch the patient. I just want to point that stuff out simply because this falsehood of saying that cervical manipulation is not safe is not true. I've never had a result in my practice that has come and been a problem. That's not to say that other people have not, but I don't believe that it was from the adjustment. It was from the fact that the doctor failed to recognize the patient was already in the midst of an early stroke / vertebral artery dissection. I just want to point that out. Again, chiropractic is very safe. No evidence has shown that a chiropractic adjustment has actually led directly to a stroke. And in this recent case, the patient clearly, with 2 weeks prior worth of headache and symptoms, was already in the midst of a vertebral artery dissection, and turning his head to the side was not what caused his stroke. And anybody who says that is probably taking a pretty big stretch on that. If you have any questions, feel free to email me, contact@pinnaclechiro.com. I'm happy to answer them to the best of my ability. Obviously, I cannot provide specific information for you as I don't have a doctor-patient relationship with you. However, I'm happy to answer any questions that I could potentially answer for you. Thank you.